Now, we've been getting a lot of questions about the hantavirus. The biggest question, does this virus spread similarly to coronavirus? Here's Dr. Celine Gounder, editor of public health at KFF News.
It's highly unlikely to spread through casual contact. What we have seen with antivirus is that, yes, it has spread person to person, but that has been in the context of very prolonged, close contact, so people who are sexual partners, people sharing a bed. In the largest outbreak of this study, sexual partners had an 18% risk of acquiring hantavirus, antivirus from their partner, but other household contacts, it was only a 1% risk.
So not spread airborne the way that COVID was?
Not spread airborne. It really requires that very close contact.
All right.
The other big question about the hantavirus outbreak is, could it become the next pandemic? We're told it's unlikely, and here's former CDC Director Dr. Tom Frieden.
This is a cruise ship outbreak. Cruise ships are very unique environments. People are in literally close quarters. The ventilation is not ideal. There are a lot of things that are touched by many people at the same time. They're hard to clean well. And so we see lots of microbes spreading on cruise ships. So it's not all that surprising to see an outbreak of something that can spread on a cruise ship. On the other hand, what's very concerning is the high case fatality rate here. This particular strain of the hantavirus is quite lethal. Now, that is not to say this is the next pandemic. Hantavirus is not set up to cause a pandemic the way, say, COVID was at this point. And there's nothing to suggest that it is on the way to doing that.
Now, locally, a lot of people are asking about the Virginian who returned from the cruise ship and how officials are preventing the spread. The CDC is not recommending that person isolate at this time, and information is still vague from the Department of Health. But here's Dr. Cameron Webb, Commissioner of the Virginia Department of Health, weighing in.
While they're not having any symptoms, isn't to necessarily isolate in their home, but the nature of the communication with our health district is really making sure that we're keeping track of any symptoms that they can have. And of course, with hantavirus and with this Andes virus specifically, those symptoms can be fairly nonspecific. It's fever, it's fatigue, it's muscle aches. And so with all of that, we're making sure we're tracking all those potential symptoms to stay in front of this. And at any point that there are symptoms that are identified, that's when we would make sure that they are isolating for sure.
Dr. Webb also added that they are talking to the person in Virginia that came home every day. Now, many of you are also asking about the symptoms just in case. So take a look here on your screen. It starts like a bad flu and then quickly turns into a respiratory emergency. With this virus, the symptoms usually show up about 2 to 3 weeks after infection. Early on, often for several days, you may feel fever, some chills, muscle aches, and a headache, loss of appetite. Some people also get nausea, stomach pain, diarrhea, or even vomiting. And as the infection gets worse, the virus can damage the lungs and cause fluid to build up, leading to cough, trouble breathing, low blood pressure, and an irregular heartbeat, and you'll need to seek help immediately.